Hello, you're watching Health Day Now. Today, we'll be joined by Dr. Stanley Feynman of Atlanta Allergy and Asthma to discuss seasonal allergies and why each spring brings more intense allergy symptoms than the last. We'll also explore how to identify misleading allergy information online and provide tips on preventing infants from developing egg allergies.
At least 4.5 million adults in the U.S. have peanut allergy, according to a new study, and many of them report developing their first symptoms after age 18. Unlike allergies such as milk or egg, which often develop early in life and are outgrown by adolescents, peanut allergy appears to affect children and adults to a similar degree, says one researcher. The team conducted telephone and online surveys with more than 40,000 people. Nearly 3% said they had a current peanut allergy, and about 2% reported a physician-diagnosed peanut allergy and/or a history of peanut allergic reactions. 1 in 6 say they developed symptoms after age 18, and 1 in 5 say they visited the emergency department each year for food allergy treatment. The authors say people who develop peanut allergy during adulthood are less likely to have a prescription for a life-saving epinephrine auto-injector. They also note that treatment is currently targeted toward children. The sole FDA-approved peanut allergy therapy is only indicated for pediatric patients. The senior study author says, given the high prevalence of peanut allergy among U.S. adults, additional therapies are needed to help address this growing burden of disease. What causes seasonal allergies and what treatments are available? If you're looking for accurate answers online, you may want to skip YouTube. A new study finds many of the allergy videos uploaded to YouTube contain misleading information. Researchers used keywords like allergy rhinitis, hay fever, and allergy to find and analyze 86 videos. More than 1/3 were found to contain scientifically unproven advice about hay fever, and less than half were found to provide useful information on symptoms and diagnosis. All of the videos uploaded by specialists, doctors, and medical associations were categorized as useful by the researchers, while only a fraction uploaded from TV shows or other YouTube channels were deemed useful. The lead author says, "Our study found that YouTube viewers may be unable to distinguish scientifically based information from misinformation." She says medical and health associations tend to be the most reliable sources.
Hello, I'm Abel Jong, and you're watching Health Day Now. Research suggests that seasonal allergies are becoming more severe as our planet warms due to climate change and pollen counts increasing. To learn how this developing trend is affecting people in their daily lives, we asked over 2,000 U.S. adults questions about their seasonal allergies as part of a survey conducted by the Harris Poll in partnership with Health Day. In the survey, a majority of U.S. adults, 76%, said they have experienced seasonal allergy symptoms at some point, but only about 43% of those individuals have been diagnosed with seasonal allergies by a healthcare provider. Of those who have ever experienced seasonal allergies, 51% strongly or somewhat agreed with the following statement: "I now experience symptoms of seasonal allergies year-round." And 46% strongly or somewhat agreed that their seasonal allergies are getting worse every year. To learn more about this trend and whether our findings reflect what allergy experts are seeing, we spoke with Dr. Stanley Feynman, an allergist at Atlanta Allergy and Asthma, and a former president of the American College of Allergy, Asthma, and Immunology. Welcome, Dr. Feynman. Great to see you.
Good to see you too, Mabel.
Well, thank you so much for hanging with us. We want to talk about this joint survey we did with our partner, Harris Poll. Just over half of those who have experienced seasonal allergies strongly or somewhat agreed with the following statement: "I now experience symptoms of seasonal allergies year-round." Now, Dr. Feynman, is this a trend you've been noticing? Why might this be the case?
The people who answered your survey are really reflecting what we see in our practice. What happens is people who have a predisposition to have allergies, and it is a genetic predisposition. In other words, generally runs in families, have a predisposition to react or develop an allergy or reaction to normal things in the environment, like pollen, okay, or like their dog, or like dust mites, or things like that. And what happens is we do know that there's a certain thing called the threshold phenomena. So people, when they continue to be exposed, they can sometimes exceed their threshold with whatever triggers their symptoms. And when you exceed your threshold, then more things can trigger it. And so that's why we see patients who may only have started having a little mild allergy symptom from a pollen every once in a while to develop more pollen allergies, then dust mite allergies and dog dander allergies. I mean, it may not be in that order, but the people in your survey are reflecting the types of patients that we see. Interestingly, when I started in practice, years ago, I was telling people start their allergy medicine on St. Patrick's Day in middle of March. Now, since we've seen the warming trends, we've seen the pollen starting sooner. I was telling people start it on Valentine's Day. But the last 2 years, we've seen high pollen counts beginning on February 14th. So now patients need to start it 2 weeks before that.
Okay.
Groundhog Day. So
late January.
February, start your nasal allergy medicine, get ahead of it, and then continue it probably through Memorial Day, at least through the heavy pollen season.
Now they are responding that these allergies seem to be worsening each year. Is there evidence of that?
Well, we do know the pollen count is increasing every year. And not only that, we know it's starting earlier. We've done surveys here in Atlanta where we've been doing pollen counts for over 40 years. And we did a report that we collaborated with the environmentalists at the CDC, in fact, here in Atlanta. And we published this last year in the Annals of Allergy for over a 20-year period of our monitoring pollen counts. And they monitored the temperatures. And what they found was that as the temperatures got warmer, then the pollen counts got higher and started sooner. So for instance, oak tree pollen, which is one of the big culprits for tree pollen springtime allergy seasons, that increased by 5% a year and was gradually sooner. Now, the interesting thing is this information was recently collaborated by scientists up in University of Michigan, where they reported and they projected a model in the future. If we continue to have as much warming trends as we're having, we'll likely see higher and higher pollen counts with the season starting sooner. And in fact, they targeted the Southeast, which is where we are here in Atlanta, as one of the biggest problem areas for patients when they are exposed to pollen. So pollen really is released more in the warming time of the year, when it gets warmer. And so as we see temperatures rise, we see pollen increase as well. So the people in your survey who are saying it seems to be getting worse, they very well could be having more problems based on the scientific data that we have on temperature increase and pollen increase.
Okay. Now, is it becoming more common for adults to develop allergies, even if they've never experienced this as a kid?
Well, we've always seen that adults can develop allergies. I mean, that's not anything new. We do see more in children. Children seem to develop allergies, more frequently than adults do. But we do have adults who say, I haven't had that much problem, and then all of a sudden, boom, I'm having a lot of symptoms. The other thing we see frequently is people moving. We have a transient population a lot now. People are moving from one place to another. They may not have that much problem in one area. They move, especially here to the metro Atlanta and the Southeast. We have a lot of pollen. They may start having more symptoms then. So it does depend upon their genetic predisposition, their exposure, and what types of symptoms they develop.
Wow. Well, I need to ask this because I know that when I'm sneezing, I'm also wondering if I have COVID. How can you tell what you're experiencing is actually allergies and not something else like COVID?
Well, it's not easy to differentiate the symptoms of a viral infection with those of allergies because a lot of them are very similar. You can get the nasal congestion, you can get the cough, you can get the drainage. The difference is you don't really get the itching when it's an infection. You also don't get the fever if it's an allergy. And generally, the cough is not that bad if it's an allergy. In viral infections such as COVID, the cough is worse, the fever is worse, and those are some of the symptoms that you tend to differentiate between a viral infection and an allergy triggered symptom. The other thing about allergy is it tends to recur. I mean, it's every year at the same time when the pollen comes out. So there is a temporal relationship between, the exposure and the symptoms, whereas a viral infection is usually contagious, so you may catch it anytime.
All right. Dr. Feynman, thank you so much.
It's great talking with you. Thanks for having me.
I've been speaking with Dr. Stanley Feynman, an allergist at Atlanta Allergy and Asthma. Thank you.
Infants who are fed eggs are much less likely to develop egg allergy in the future, according to a new study. Researchers examined U.S. government data from nearly 1,400 parents who filled out surveys about their kids' eating habits and food allergies from birth to 6 years of age. They found that children who hadn't eaten eggs by 12 months were much more likely to have egg allergy at 6. And children with egg allergy at 1 and 6 years of age ate fewer eggs as infants. The senior author says, current evidence suggests that early introduction of egg during infancy followed by consistent and frequent feedings seems protective against development of egg allergy. He says research continues to determine the optimal timing of egg introduction. Since 2017, allergists and pediatricians have recommended parents start to introduce peanut products into their child's diet around the time they begin eating solid foods to help prevent peanut allergy. Your smartphone may be covered in allergens, especially if you're a pet owner. Researchers say most people don't think of their smartphones as a trigger for immune reactions, but they can be loaded with inflammatory agents. The researchers had 15 volunteers use simulated phone models and then swipe them for testing. High levels of cat and dog allergens were found, mostly on the smartphones of pet owners. But excessive amounts of BDG, a component found in fungus, as well as endotoxin, were also discovered. The researchers call endotoxin a potent inflammatory agent and say BDG can cause airway and other irritant symptoms. One study author says if you have allergies or asthma, you may want to think about cleaning your smartphone more often to minimize exposure to these allergens and asthma triggers. What holidays do you think are most worrisome for kids with peanut and tree nut allergies? Researchers compared cases of nut anaphylaxis, a severe, potentially life-threatening reaction during Halloween, Easter, Christmas, Diwali, Chinese New Year, and Eid al-Adha. They included nearly 1,400 patients who ended up at pediatric emergency departments in Canada from 2011 to 2020. For peanut anaphylaxis, they found an 85% spike in daily average cases during Halloween and a 60% increase during Easter compared to the rest of the year. For anaphylaxis by unknown nuts, there was a 70% increase during Halloween and Easter. The authors say the difference among holidays may be due to the social setting in which each typically takes place. They say, at Halloween and Easter, children often receive candies and other treats from people who may be unaware of their allergies. The absence of such an association at Christmas may be because Christmas is a more intimate celebration among family members and close friends, who are more vigilant regarding allergen exposure. The study says more educational tools are needed to increase awareness and vigilance about the presence of potential food allergens. Children with asthma or food allergies may be at increased risk of irritable bowel syndrome in their teens, according to a new study. Researchers in Sweden analyzed the health of more than 2,700 boys and girls from birth to the age of 16. They found that kids with IBS at 16 were almost twice as likely to have had asthma at the age of 12. And about half of participants with IBS reported food allergies when younger. The lead author says this knowledge could open up for developing new treatment methods for adolescent IBS, targeting processes of low-grade inflammation seen in these allergy-related diseases. Irritable bowel syndrome is the most common functional intestinal disorder and affects between 6% and 14% of all teenagers.
Thanks for watching Health Day Now.